The National Medical Center will kickstart South Korea's vaccination program in a few weeks. It will become a model for other vaccination centers nationwide. Seoul will set up enough to inoculate 70% of its population by November. Lee Kyung-eun tells us more.
South Korea's first COVID-19 vaccination center has been set up at the National Medical Center and is waiting for Pfizer's vaccines to arrive in a couple of weeks. The temperature-sensitive vaccines will be transported using a comprehensive cold chain system. At the end of the chain is a state-run institution that's fully equipped to store the vaccines at -70 degrees Celsius.
Vaccines will be stored in ultra-cold freezers. Then they will be thawed at the vaccination site and diluted with sodium chloride to make 5 to 6 doses before being administered.
The center is divided into 3 sections, all of which are designed to follow social distancing. Upon arrival, recipients will verify their eligibility, proving they're from the designated group, for instance, frontline medical workers in the case of the first quarter. Next, they'll be briefly screened by medical staff to see whether they are in the proper health condition to receive the jab. When given the OK sign, they will proceed to get the vaccine. The final stage is monitoring any adverse reaction.
Those with pre-existing medical conditions or a history of allergic reactions to the vaccine will be required to stay for 30 minutes, while others must stay 15 minutes.
Though very rare, adverse reactions like anaphylaxis could occur. In such cases, the on-site staff will carry out emergency care. Ambulances are also on standby to transport patients. With such safety concerns, the number of recipients will be limited to 600 each day. While carrying out the first rounds of COVID-19 vaccinations, the center will act as a model for some 250 other vaccination centers that will be set up nationwide. It will also be in charge of training staff in those centers. Lee Kyung-eun, Arirang News.